Hi, my name is Ashley Cifuentes, and I'm going to be doing the trauma assessment skill. I'm going to put on my PPE, and at this point, I would be in the ambulance on my way to the scene, and I would be assessing scene size up as we approach. First, I would check if the scene is safe. I've determined it's safe. Then, I would determine her mechanism of injury or nature of illness. Her mechanism of injury is a fall. Then, I would determine the number of patients. I only have one. Then, I would determine if I need backup. I don't, as I only have one patient. And then, I would consider C-spine immobilization. Next is my general impression. My general impression is she's a 15-year-old female lying supine on the floor after a fall, and her chief complaint is leg pain. She is alert. She is talking. She is alert times 4. She knows her name, where she is, what happened, and what time of day it is. I'm going to assess her airway. Considering C-spine, I'm going to do the jaw thrust. I'm going to assess the airway, if it's patent and will stay patent, and it is, and it will. Then, if it wasn't, I would insert an either oropharyngeal airway or a nasopharyngeal airway. Then, I do assess her breathing. I'm going to take her pulse and check her breathing at the same time. While I'm doing this, I look at her breathing. I look at her depth of breathing, whether it's adequate, inadequate, trouble breathing, labored breathing, or any other type of breathing. Then, once I know it's adequate, I assess the ventilation. She has adequate ventilation. Then, I assess if she needs oxygen. She does not need oxygen. Then, I manage any injury affecting breathing. There is none. Circulation, I've checked her pulse. Her pulse is steady, strong, and regular. Then, I assess her skin. Her skin is warm, pink, and dry. Then, I assess any major bleeding and control it, and there is none. Then I do shock management, which she is not producing any signs of shock management, of shock. Then I perform sample. I have her signs and symptoms. She just has leg pain. Then I ask for her allergies. She has none. Then I ask for her medications. She is taking over-the-counter ibuprofen and over-the-counter children's vitamins. Her past pertinent medical history, she has none. And her last menstrual cycle was 1 week ago. Her last meal was 30 minutes prior to my arrival. And the events leading up to this, she was walking down the stairs and slipped on the last step and fell. Then I obtained her vital signs. I've obtained her pulse, her breathing rate, and I'm going to assess another pulse to make sure it's normal. I get that rate. I check her pupils for pearl. And I check her blood pressure. Then I do the secondary assessment. So I start by checking the mouth. Then I check the nose. I'm going to palpate. I'm going to check the ears for cerebrospinal fluid. I'm going to check the nose for cerebrospinal fluid. Then I'm going to palpate, face, the neck. I'm going to look for any discoloration. Then I'm going to move on to the shoulders, then the chest, then the abdomen, then I'm going to move on to the leg, she notices pain when I touch right above her knee. Her pelvis is stable. Next, I'm going to log roll her. 3. 1, 2, 3. And I'm going to auscultate lung sounds. And I'm going to feel her back for any off steps, step offs, and any abnormalities. I'm going to carefully log her back. I'm going to check for JVE, tracheal deviation, and then I'm going to reassess.